Welcome to the December Spotlight on Long-Term Care, brought to you by ProducersWeb.com. I'm Sarah Fletcher, and in this broadcast, we'll cover some of this topic's biggest trends and insightful research. This Spotlight on Long-Term Care is sponsored by Galebox Insurance Services, your LTC experts. For more information, please visit www.galebox.com. The American Association for Long-Term Care Insurance recently published the Guide to Tax-Deductible Long-Term Care Insurance, a handbook that explains 2010 tax deductibility rules and limits for individuals and business owners purchasing LTCI. To encourage individuals and small business owners to purchase LTCI, the federal government and many states have started offering tax deductions and tax incentives. The guide explains tax rules for individuals as well as those who are self-employed or own small businesses. Meanwhile, the association has also published a booklet entitled Accountant's Guide to Long-Term Care Insurance, which provides comprehensive information and internal revenue codes that pertain to various tax deductibility rules in the new 2010 age-based limits for LTCI tax deductions. According to Jesse Sloan, Executive Director of the AALTCI, quote, tax deductions and credits are going to be increasingly important and a most significant selling point insurance and financial professionals can use to encourage long-term care planning, unquote. The Life Foundation reports that 9 out of 10 Americans do not have a plan to pay for long-term care services, such as a home health aide, which currently costs more than $40,000, and private nursing home care, which is approaching an average of $75,000 annually. Reports indicate that nearly 25% of Americans will rely on family and friends, while others mistakenly believe their health insurance coverage or government programs such as Medicare will cover long-term care costs. When asked what they would rely on to help pay for long-term care services if they found themselves in need of assistance with the basic tasks of daily living, 23% of Americans cited family and friends, 20% cited health insurance, 16% cited Medicare, 13% would turn to personal savings, 11% would count on Social Security benefits, 10% would use LTCI, and 7% would rely on Medicaid. According to one board member with the Life Foundation, quote, these survey results illustrate that most people are confused about how they will pay for long-term care services, which is a scary thought considering 70% of Americans who reach age 65 will need such care at some point in their life. Health insurance will not cover long-term care services, and government programs like Medicare and Medicaid have many limitations. That's why it's critical for Americans to take steps to protect themselves with long-term care insurance, unquote. I'm Sarah Fletcher, and thanks for watching the Spotlight on Long-Term Care. To see more video spotlights on your favorite products and practices, find them on ProducersWeb.com and browse by topic.